Afternoon. Thank you for joining us today. My name is Jeremy Drucker, and I'm the State Director for Protect Our Care Minnesota. We're honored to be joined by U.S. Senator Tina Smith, Congressman Dean Phillips, Sarah Stays, President and CEO of Planned Parenthood North Central States, Clara Boykin, a member of SEIU Healthcare Minnesota, and Kenza Haj Musa, Director of Public Affairs for Take Action Minnesota. Earlier this month, Protect Our Care kicked off the Your Health, Your Vote virtual bus tour to make sure voters know healthcare is on the ballot in November. The virtual tour is making stops in 16 key 2020 states in the coming weeks. And make no mistake, healthcare is on the ballot this election. Trump and his Republican colleagues have taken every opportunity to sabotage our healthcare, pledging to take healthcare away from millions of Americans and gut protections for pre-existing conditions, not to mention slash funding for Medicaid and Medicare, even in the midst of a pandemic. The Trump administration is now arguing before the Supreme Court to invalidate the Affordable Care Act. They're trying to do through the courts what they couldn't do through Congress. If successful, Trump would rip away healthcare from 23 million Americans, including nearly 300,000 Minnesotans, and end protections for more than 135 million people with pre-existing conditions. That includes millions of Americans who have contracted the coronavirus. In Minnesota, there are over 2 million Minnesotans with pre-existing conditions who would be at risk of losing coverage. While Trump claims that he will protect people with pre-existing conditions, it's important to note that that is all talk. As Larry Levitt from the nonpartisan Kaiser Family Foundation points out, Trump's claim is, quote, not a plan, it's a mirage. It's a series of aspirations with no specific policy proposals to back them up. Contrast that with Joe Biden and healthcare champions like Tina Smith and Dean Phillips, who are fighting for lower costs and better care, and with actual plans for how to do it. They want to build on the success of the Affordable Care Act and not undo it. They want to move forward, not back. I'd like to turn it over to U.S. Senator Tina Smith now to say a little bit more about what's at stake in this election. Senator?
Well, thank you so much, Jeremy, and thanks to everyone at Protect Our Care for lifting up this issue of healthcare, which is so important. And I'm so delighted to be with my fellow panelists here today. It's lovely to be with you. So I start from the fundamental value that everybody in this country should have access to high quality healthcare that they can afford, no matter who you are or where you live. And that goal has been significantly advanced through the Affordable Care Act, which made important steps forward, including expanding insurance, as Jeremy said, for millions of Minnesotans and millions of Americans. It helped stop the practice of insurance companies for discriminating or denying coverage flat out to individuals who had pre-existing conditions like asthma or cancer or diabetes or being pregnant. And it also helped to make really important expansions of Medicaid, which has expanded insurance to so many people. And a lot of people don't really understand what Medicaid is, but here's just two little pieces of information which help you to understand how important Medicaid is. Half of all babies in this country are born with coverage through Medicaid. And so many families count on Medicaid to help them provide the basic health care and needs that they have if they have children or adults living in their families who have significant disabilities. So this is part of the infrastructure, the net of healthcare to fulfill or at least get closer to that promise that everybody has access to healthcare that they can afford no matter who they are or where they live. Now, understand what's happening right now. The Trump administration has a case before the United States Supreme Court seeking to overthrow the Affordable Care Act. And understand that they attempted to do this in the legislature, in Congress. In 2017, they attempted to overthrow the Affordable Care Act, and by one vote, they failed. One of the reasons that they failed in this effort was because Americans rose up, they used their voices, they expressed their strong desire that the Affordable Care Act should stay in place. Now, here we are at an epic pivot point in our country where the Trump administration is attempting to rush through a Supreme Court nominee that would go on the Supreme Court just as it is preparing to hear the Affordable Care Act. They are using their power. It is a power grab in order to overthrow the Affordable Care Act. And I think in this moment, Americans need to lift up their voices. They need to make their voices heard, because I do not believe that this is what we want in this time. It's not what we need in this time, a moment of a global pandemic when people's healthcare, their economic and their health and their well-being are so threatened by the deep challenges that we all experience because of this pandemic. So I'm really grateful to Protect Our Care for giving us this opportunity to talk about these issues, to explain what is at stake in this moment, and to help people to understand how they need to lift up their voices. You need to lift up your voices to say how exactly you feel about this moment. Thanks so much, Jeremy.
Thank you, Senator. Thank you for that really clear articulation of what's going on right now. Representative Phillips, you're up next.
Great, thank you, Jeremy, and thank you, Senator Smith, and to Protect Our Care. Grateful for the good fight that you are leading on behalf of millions of Americans who are asking all of us in Congress, every one of us in positions in which we can be advocates, compassionate advocates, to do something. And I know Senator Smith and I are just two of 535 members of Congress who hear regularly from our constituents all across the country, rural, urban, suburban, everything in between, that they want better quality health care, more affordability, and better access. And the question is why? Why is the most successful, wealthy, prosperous, innovative, extraordinary country in the world falling so far behind our peers? That's a question we have got to address and do so quickly. You know, the COVID pandemic has laid bare, very significantly laid bare, the fact that we do not have a healthcare system in America. We have sick care. We don't have healthcare, and we don't even have a system. We have a patchwork of public and private operators and providers and clinics that is hard enough for even the most educated and able to navigate, leaving so many millions of Americans trying to figure out why we don't have a system and why we have a patchwork. And it defies reason, but the administration continues to fight the ACA. The one thing that this country has done in the last 20 years to expand access, try to reduce costs, provide incentives to reward outcomes and quality instead of procedures so we can reduce the cost of care. And clearly the fact that we've lost 200,000 Americans is a combination of a lot of reasons, one of which is the fact that we do not have a system. And we need leadership. It needs to be bold, and we have to get to it. You know, Americans already subsidize the entire world's prescription drug pricing. We already pay double for our healthcare of that of any developed nation in the world. We spend $10,000 per capita in our country for healthcare. That's double. We have the money in the system, I would argue. And I will offer to you and submit to you that we can use the money that's already being spent every year to cover every single American. It's just a matter of will and intention and good-hearted people, especially in Congress and eventually in the White House, to get that done. I know that Senator Smith and I are co-sponsors of a plan that would allow states to permit their citizens to buy into Medicaid. And why do I like that? Because it's one of the few plans that actually combines conservative and more liberal thinking. Conservatives want to see more competition, the freedom to make a choice. I'm not an advocate for the public delivery of healthcare, but I am an advocate, like Senator Smith, to allow Americans to make the choice for themselves if they would like a public insurance plan. It's not rocket science. And we believe if we let states be the laboratories and do the testing and identify the opportunities, perhaps we can identify some ways to be a better and more innovative country, allow more people to buy into a plan that they can afford, and especially as we emerge from COVID and more people will be working from home in the gig economy as independent contractors, they need portability of insurance. And any of you who've tried to obtain insurance on the individual market will know how complicated it is. This is, again, not rocket science. Every one of us in Congress hears it. I'm eager to inspire some thoughtful bipartisan solutions. We've got to get to it, and I'm grateful to Protect Our Care, you, Senator Smith, you, Jeremy, and everybody on this call for listening and eventually advocating so we can get this done. Thanks, everybody.
Thank you, Representative Phillips, and thank you for your leadership in Congress on this really critical issue and on the prescription drug fight that I know you've been fighting for a long time, too. So thank you.
Thank you.
Sarah, you're up next.
Thank you, Jeremy, and thank you to all of my friends who are with me today on this very important call. I really appreciate everything that you all are doing, and especially Senator Smith and Congressman Phillips. Thank you for your tireless leadership in Washington. I know it's a really hard place to be some days, and you never give up. either one of you. I'm just very, very grateful. Thank you. I just keep thinking about the future of reproductive health care in our country and how so much of it for so long rested on the shoulders of Ruth Bader Ginsburg, our Supreme Court Justice. She was just an incredible woman, phenomenal. And now it is really up to us to make sure that we can continue the fight and to maintain the work that she did, her legacy. She broke so many glass ceilings. And one of the important things that she did was to coin the whole phrase, gender discrimination. And she fought every day to make sure that the three words, we the people, that appear in our Constitution really came to life for all the people in our country. And unfortunately, now that she has died, we are going to have to redouble our efforts to make sure that we the people stays alive as an important idea for all of us here in America. She was a fierce and relentless advocate for women. She really ushered in a new era of opportunity that I myself have benefited from, and my daughter today is benefiting from, and so many millions of women in our country are benefiting from. But now all of these opportunities are at risk of being shattered. And I'd say more than at risk, there's a great probability that they will be shattered by actions that will be taken by the Supreme Court. We've talked about the ACA and how important it is for everybody in this country. And I just really want to underscore how important the Affordable Care Act is for women, ensuring, for example, that pregnancy cannot be considered a pre-existing condition. And of course, we also know that abortion access through Roe versus Wade and many other decisions that are currently pending at the federal appeals court level are at risk of overturning our access to that very important health service as well. But basic health care like birth control is really at danger. It's really in danger here. We have seen in our most recent Supreme Court decision in which the court ruled that your employer can decide whether or not you have coverage for birth control in your employer-sponsored health plan. And that was a terrible decision, and it inches us one step forward closer to losing birth control access. And I know how important access to birth control has been in my life. I have been able personally to choose my own life and to have the number of children that I wanted to have and could support because I had access to birth control. And that access now is suddenly being threatened for millions and millions of women in this country. The patients that we see are particularly vulnerable and will be the hardest hit of all if these important protections are rolled back, because our patients come to us without very much money and without access to care in other places. And so we know every day, we see every day the potential effect of the loss of these important protections and access to healthcare through the Affordable Care Act. Women need to have access to reproductive health care in order to be able to live lives of our own choosing. We know that the forthcoming Trump nominee is not going to be our friend. And we know that we are all going to have to redouble our efforts to make sure that we do everything we possibly can to keep healthcare access a reality for women and men and every single person in this country. So thank you very, very much for being with us today.
Thank you, Sarah. Thank you so much for those remarks. Clara, I want to introduce Clara Boykin now from SEIU. She's graciously taken her lunch break to be with us, and so I want to thank her particularly for that. Clara, go for it.
Hello, my name is Clara Boykin, and I'm a member of SEIU Minnesota, and I'm a lab technician, and I've been in healthcare field for over 30 years. And I'm so pleased to be here for this exciting topic that we're talking about today. And I thought about this, and the more I thought about it, it's like I've always been a person, even though I'm in healthcare, I've always felt that everyone should have affordable health care. That's my bottom line. And it was, as it was stated, in the United States of America, one of the richest countries in the world, we should not have to worry about affordable health care. We should not have to worry about our family members not being able to see the doctor. And that's one of my stories I can tell. I have family members who cannot afford to go to the doctor. They can't afford to get their medication refilled, all because they cannot afford the cost of health care. And as I said, we're in Minnesota, and we're so often said Minnesota nice, but we also need to look at the disparity, at the subtle racism as to people of color or Black Americans, how the system, it has been really affected people of color as far as the healthcare system goes. The racial justice system is making healthcare really unaffordable. And that's something that we as people, all people, we need. The Affordable Care Act, it's a start, but we don't want to go backwards. And this is what it's appeared to be happening now, is that we're going backwards. And before I make my last statement, I just want to say that a lot of Americans are continuing to work because they can't afford health care. And that's the fact. That's the bottom line. I challenge any of the representatives, the politicians who really feel the need to abolish the Affordable Care Act, to put themselves in our position. What if you had a family member who could not afford health care? They were ill, they couldn't go to the doctor. How would you feel? I mean, it's my passion that everyone has affordable health care. I really thank you so much for this opportunity to speak on this. Back to you, Jeremy.
Thank you so much, Clara. Kenza.
Good afternoon, and thanks for having me. My name is Kenza Haj Musa. I'm the Public Affairs Director at Take Action Minnesota. We're an independent grassroots organization with offices in St. Paul, St. Cloud, and Duluth. We believe that no matter where we live, what we look like, or how much money we make, that everybody deserves care and the opportunity to live a good life. Take Action has worked on healthcare issues for the last 14 years. Our members helped bring some of the best pieces of the Affordable Care Act into Minnesota. We passed a state health insurance exchange that's given us more flexibility and control over our health insurance system. We established a basic health plan that brings hundreds of millions of federal dollars into the state for Minnesota Care. Most importantly, we helped expand Medicaid for tens of thousands of low-income Minnesotans in 2011. Imagine where we would be in this pandemic without the Affordable Care Act in place. Right now, we have a choice, not just about healthcare, but about what kind of government we want. As Minnesotans, we believe the role of our elected officials is to carry out the will of the people and to serve the common good. Repealing the ACA does absolutely nothing to help people. Right now, Minnesotans are literally begging for their lives. Big Pharma is killing people by price gouging life-saving medicine. Today, there are Minnesotans fighting to survive because they can't get to Canada to get prescription drugs that they need to stay alive. Farmers and small businesses are drowning in debt, and they're desperate for a public option. Rural communities need access to care, and all of us need lower prices. Instead of working to address these issues, Republicans have spent the last decade voting to repeal the ACA. They've spent the last decade denying Medicaid expansion to millions of low-income people. In 2017, they slashed Medicaid to finance tax breaks for billionaires and corporations, and now they're ready to use the Supreme Court to repeal the ACA. Their actions speak louder than words. This lawsuit is fully owned by the GOP, but it's not about politics. It's about people, and it's about life and death. Every single person has inherent worth and dignity, and when Republicans go after the ACA, they're going after Medicaid, and it's not an accident. They're targeting healthcare cuts for the poorest people, people with the least political power. They're targeting people who are sick, who are affected by the opioid crisis, essential workers, and people of every race, color, and background who need care. 200,000 people have died of COVID-19 in the US under the Trump administration. Make no mistake that more people will die when the ACA is repealed. There's a better path forward, and we have the power to decide the direction of our future. We are going to keep fighting like hell for the living and for a public healthcare system that leaves nobody out. So thanks to you, Jeremy, and Protect Our Care. I'll send it back to you.
Thank you so much, Kenza, and thank all the panelists too. We're gonna take a few questions from reporters now with some assistance from Protect Our Care home base. Kelly, what are some of the questions out there?
Yeah, so at this time, I would like to invite anyone who is on Zoom and has a question for our panelists to go ahead and enter that question into the chat box via Zoom. We already had one question come in earlier, and the question is, what would happen to Minnesotans with pre-existing conditions if the Affordable Care Act is eliminated? And I believe that's for anybody on the panel who wants to jump in.
Sure, and does anyone want to take that, or Senator Smith?
Yeah, well, you know, the fundamental reality is that the protections in the Affordable Care Act that stop insurance companies from discriminating against people because they have pre-existing conditions, those protections would go away if the Affordable Care Act were overturned. And think about what that means. You know, I've not talked to a single Minnesotan who wants to go back to the bad old days when, if you were a senior, you struggled to get insurance that you could afford before you were on Medicare. That if you were a woman, that you were faced with paying significantly more for your health insurance plan, because that's what insurance companies were allowed to do. They were allowed to charge women more. Sometimes you hear the Republicans on the other side talk about how they support protections for pre-existing conditions. But I ask you to look behind the language. Even just yesterday, the president said, I'm passing an executive order that says we stand for protecting people with pre-existing conditions. But it does not matter if you use that language if you don't also link it to whether or not you would be charged exorbitant rates if you have a pre-existing condition. That is the fundamental difference. And that is what people need to pay close attention to as I listen to this debate, because there are folks that are going to try to confuse you about this, and we cannot let that happen.
Thank you, Senator.
Yeah, thank you so much. We actually have a follow-up question for you, Senator Smith. The question asks, what are you hearing about healthcare when you're out on the campaign trail? Your opponent is stressing law and order, COVID restrictions, and the Supreme Court nomination. But what are you hearing from voters about what's important to them? And that question comes from Steve Karnowski.
Well, this is a moment where Minnesotans are feeling so much uncertainty, so much anxiety and concern that we don't even really know what's going to happen next week, let alone what's going to happen next month. And that is creating so much stress for people. And no matter where I go, whether I am in Duluth or Hibbing or Hermantown or Worthington or Wilmer, wherever I go, people are very focused on those issues that affect their lives most directly. Are they going to be able to get access to health care if they've lost their job and they maybe have also lost their insurance? How are they going to support their family? How are they going to pay for childcare in this moment where the access to childcare is even more difficult than it was before? So these kind of home-based economic issues are what is on the minds of the voters that I'm talking to. And I think there's an effort out there to confuse people and to try to say, oh, this is about, you should be fearful, you should be scared. And I don't really hear that coming from Minnesotans. I have them trying to figure out how to make their lives work. And that is why the Affordable Care Act is so important. And it is what is at stake in this Supreme Court nomination that the Republicans are rushing through in order to get their way on the courts because they haven't been able to get their way legislatively. And that's why people need to raise their voices and be strong.
If I could just reiterate what Senator Smith just said, that's exactly what I'm hearing from my constituents, exactly the same. You know, they're not buying into the fear machine, they're buying into the reality that we should be fearful about COVID and the lack of a federal response, fearful about the ending of unemployment benefits on which people are relying, fear that the ACA could be dismantled and healthcare go up and coverage go down. I mean, you know, these are the truths. And to all those on the call and the reporters, it's shameful. It's shameful behavior to use fear to divide a country during a time like this, instead of get to work and protect people and preserve life, preserve liberty and livelihoods. It's nonsensical. And there's a backlash, to be forthright. because I'm hearing the same thing that Senator Smith just referred to. And I hope all Minnesotans recognize what's really going on.
Thank you. Just one more call to anyone who is joining us on Zoom. If you have a question for any of our panelists, please go ahead and enter that question into the Q&A or the chat box in Zoom. We do have one more question for you, Congressman Phillips. The question asks, if the Affordable Care Act is eliminated in November, how could Minnesotans who contract COVID-19 and are suffering longer-term health consequences because of the virus be affected by the repeal?
Well, everybody who has benefited from the ACA is at risk. And this, by the way, this risk has been present since the very beginning of the Trump administration, which has been relentless in its pursuit to dismantle it. And by the way, you know, we serve in public office, we're legislators, we're always willing to listen to new ideas, but to try to dismantle a program that protects millions without a replacement proposition is confounding, dumbfounding, and just irresponsible, and a dereliction of duty. So to answer the question, that's everyone's rightful and realistic fear is what happens. You know, with Donald Trump in the White House right now, it's clear what would happen. We've seen his response to COVID, we've seen his intention to make empty promises, and we've seen the intention to dismantle the ACA. Will we respond as a community in Minnesota to take care of people? Darn right we will. We will find a way. But the problem is the way we find those ways right now is the most expensive, least efficient, and ineffective way to do it. And that's why thoughtful Democrats and Republicans, and there are plenty, have got to start coming together, finding common ground, and creating spaces and places to listen to constituents and get to the legislative work necessary to do better. This is not a political issue. Encouraging people to have more coverage for people and to reduce costs of care. It's not. So to those who are concerned, we will have your back in some way, I promise. I just wish a president was in the White House that would make it easier and support that effort.
Great. Jeremy, it looks like those are all of the questions we have coming in at this time. So I'm going to go ahead and turn it back over to you.
Sure, thanks, Kelly, and thanks to all the panelists. And I just want to pick up on something that Senator Smith and Representative Phillips said on the way out here is just that, Republicans put their best foot forward in 2017 with a replacement plan, and it was ineffective. It cut Medicaid. It charged more for seniors. It was woefully inadequate, and the voters made their voices heard, and it was voted down. And they haven't come up with anything else since. And so, what's at stake right now is really serious with what's in front of the Affordable